Good afternoon, everyone, and you're welcome to another episode of Physio Nextdoor. My name is Jennifer, your host, and here with me to give us some enlightenment on so many things about physiotherapy is Dr. Nnamdi Eze. A round of applause.
Thank you.
All right, so you're welcome. So in the first episode, which I believe you must have listened to, we did a little introduction of what this podcast is all about. Don't forget, I said it's Physio Nextdoor. So you don't have to go so far. We're just by the side of your house, right? To give you solid and legit information about your physical health and wellness. All right, so over to what we have for you today. For today, we're going to be talking about a number of things around MRI and some other conditions that people experience, with regards to their physical health. So yes, we have an authority in physiotherapy here, so not to worry. He's going to be giving us a lot of value and information. So yes, over to you, Dr. Nnamdi. Our very first question. I want to know, because I think I've heard from people, sometimes when they come around to make inquiry, they ask certain questions and they're like, okay, I want to see the doctor, and I've actually done a number of tests like MRI. I've also done X-ray and the like. Do I need to come along with these results? But before you go into telling us some other things, I want to know, what is the meaning of MRI?
Okay, so thank you very much. Thank you for having me. And it's a good thing that we are talking about this topic that is quite of a big concern, even for us within the healthcare community and the people who are always seeking for help from us. Yeah, so MRI simply stands magnetic resonance imaging.
Okay.
It's a complex, versatile, highly sophisticated diagnostic machine that has revolutionized how diagnosis and imaging is done. And the interesting thing about it, it's non-ionizing. So what it means is it does not radiate so much of rays that were really a bit of a concern when the X-rays and the CT scans were in use.
Okay.
Thank you.
All right, thank you so much. So we're going to be streamlining this episode to a topic, and that is, do I need an MRI for my back pain? Yes, you may have wondered, so we're here to answer your question. Do I need an MRI for my back pain? So how many people, I'm going to ask you a question now. So how many people generally require MRI or scans?
Yes, so in a typical clinic, let's say a musculoskeletal clinic, just like you said, for back pain injuries. A typical musculoskeletal clinic, when people coming into wanting to see a physiotherapist, a back pain specialist, usually you have about 50% will eventually have the need to get an MRI. The reason being that in most cases, you tend to see issues bordering on areas of non-specific conditions and very specific conditions. And why I said 50% instead of just saying less than that is because sometimes you may really need to, want to look more in depth into why these people are coming with some of all these concerns. But because 50% tend to want to get this diagnosis done, that does not even mean that they really needed it. Because there is an interesting review about who should get an MRI and who should come with an MRI into a practice. So if you triage, more like break most of the back conditions into three, you might have the specific conditions, you have the non-specific conditions, and you have some of the very rare issues, some of them which are cancers, inflammatory conditions that really require some diagnostic imaging. And sometimes the most preferred is usually the MRI because it shows you beyond just the bones, shows you into the muscles and so many of those things. So when it comes to wanting to get the imaging, it's important and it's always necessary within our practice that you should get to see the person first, diagnose the person, perform your musculoskeletal assessment first. Then, if you think the imaging is going to change the course of your treatment, or you think the imaging is going to reveal something that you are probably likely going to miss out within just your examination, then it will be important to order for that imaging. But if you allow me to say, within the classification of the different categories of low back pain, I will tell you within my practice, only 2%, 1 to 2% will get an MRI. These are people bordering on areas of cancer, different fractures, and so many other things. But most within our community, most of the people who come in with non-specific low back pain, and usually your assessments will take care of their concerns.
Okay, that's beautiful to know. I would also want to know what are the different kinds of MRI or scan you can send people who actually require it for?
Okay, yes. So just like I said, the MRI being a revolution in diagnostic medicine had really changed the ways in which diagnosis is being ordered. And that is because of its specificity. It's very, very specific. What it means is it's very specific and very sensitive. It can pick anything. Before then, for back pain, you could get x-rays. X-rays are the very interesting machines. You go into the radiology department, you get an x-ray. But when it comes to back pain, x-ray is quite limited because it just shows you nothing below the bones. So in issues where you are suspecting that if someone comes into the office and is telling you that he started having back pain after he fell, so if there is a likelihood of this person coming down with fracture, the x-ray will be the first thing you should order if you suspect. But usually some of all these conditions do not hide themselves. You understand? And again, if someone walks into the clinic and there are histories of weight loss, histories of sickness, not being able to sleep at night sweats, recent weight loss, then you begin to suspect cancer. Cancer shows really very well on x-rays too, especially when it's going through metastasizing into the bone. You could see some of those traces of the metastasis within the x-ray. Then the second one is CT scan. That is, with CT scan, a little bit of an advanced x-ray, but it also has ionizing radiation. So it's not being requested as much. I can tell you a story about most people who will want to get x-rays. Like in the past, someone who were suspecting that we needed to get different slices of probably the suspicion of a cord compression. And the MRI was not really very handy. You are not going to be sending for an x-ray. The next thing you are going to do is to send for a CT scan because it has the possibility, the potential of showing some trapped nerves too, even though not as clear as the MRI will do, but it's a little bit of an advanced imaging equipment compared to the x-ray. Then another thing that, talk about the elephant in the room now, the MRI now is the third machine, which is also very frequent in this day and age. Lots of people will always want to order it. Now it goes beyond just showing you the bones, showing you the muscles, showing you the nerves, and showing you the kind of compression each of them are going through.
Oh wow, it must really be a powerful one. Okay, so what do you look out for when requesting either of the scans you just mentioned?
Yes, so just like when I talked about if someone comes into the clinic, remember your choice of diagnostic tool or machine is highly dependent on the interaction you have with the client or the patient who walks into your office. If he says he sustained a fall, he hasn't had any back issues, and he sustained a fall last week or 3 days ago, and he discovered that there was swelling, maybe around the hip, because sometimes within the hip it goes to the back, and I want to get an x-ray to know if there is a bit of a fracture, and that informs my choice to want to use an x-ray. But most of the time, within what we see in our facility here, you tend to see a lot of people who come in with very non-specific low back pain issues. And this time around, because they are quite non-specific, you may just want to do your assessment, and that is fine. But in situations where it could be specific, like wanting to see the level of interaction or compression within the nerves, like in most people, you tend to hear things like cauda equina syndrome, which is the compression, and this kind of people retain urine, and they are considered medical emergency. So these kind of cases are specific because the explanation that the individual is giving you is likely going to be related to the pain or the symptoms he is feeling. So then you can then relate the possible condition within the books that correlates to what this explanation this individual is giving you. Then that informs your decision to want to order an MRI. But in a situation whereby this person is just telling you he's feeling back pain, there is no issue of the pain is going down my legs, there is no issue of I can't sleep at night. It's just typical pain. I go to the office, when I stand up, the pain is better. When I sit down, the pain comes back. When I sit down for long, then you know that these are just non-specific mechanical problems that will go with rest. So there is no point ordering for MRI. And the interesting thing is that is over 90% of the cases of back pain that we see in our office. Yes.
That's visible. So it's not advisable that when one just begins to feel have back pain, the person just jumps into, okay, let me go for an MRI,
No.
without consulting a physiotherapist to know if that is necessary or not.
Yes, so within the scope of physical therapies, you order because you want to have a detailed reason, a detailed diagnosis, or make an inference or impression about what this particular individual is going through. So it's important that you look at them, try to correlate what they are going through in line with what they have explained to you, and make sure that if you order this MRI, it's likely going to change your course of treatment.
Okay. That's well noted. All right, so let's move over to the next question. What's the first thing that comes to your mind when you see a patient?
Yeah, so the first thing that comes to my mind when a patient walks into an office is, how did this person walk in? That's what we call the observation. You need to observe the way the person walked. You need to observe the way the person sits. You need to observe the way the person stands from sitting. Then your treatment doesn't start with your administration of medications or modality. Your treatment actually starts with how the person walks into. Then you begin to create a mental picture of what's the likely reason this person is coming into my clinic with. If this person is elderly, for example, he's elderly, he walks in with a stick. And in the course of his explanation, he tells me why he's using this stick is because it allows him to stoop so that he can walk longer. Because without the stick, he doesn't even walk just few distance without having lots of pain, grabbing his leg. Then I create a mental picture of a possible canal stenosis. This is a medical condition that happens from elderly, most of the time people who are 60 years and above. Then that gives me that picture. So from the way they walk into the clinic, the way they sit, the way they stand, then I'm creating a mental picture of what's the most likely condition these people are going through. Then if I feel diagnostic request like MRI is going to change my course of intervention with them, away from what I've always known, just like I said, with experience, you gather some of all these indications. Then you then decide what decision you should be able to take next in the managing of these clients.
Okay. So I want to know, we've talked about some advantages and how MRI helps, in giving an inference on what you're to tell a patient or the treatment you're to give a patient. So now let's look at the cons, right? So what is the likely downside for sending a client for a scan, especially when the person doesn't need it?
Now, this is very interesting because it's happened a lot within my practice, and some of my friends also talked about it. Now, it's an expensive modality. And when someone walks into your clinic, and the first thing you tell the person is to go and get an MRI. So I'll tell you something very interesting. When they walk into the clinic, and the first thing you say is to go and get an MRI without having a detailed examination of what's likely going to be the reason why they should get that, in agreement with the client, they are likely not going to come back. The reason is, it is possible that in the past, such diagnosis has been ordered. Good. Now imagine what it is that you sent a client to go get this MRI. He goes, gets it, and he didn't change what you're doing. We may think that, yes, I am sure that I will continue, but that's not how practice is supposed to be done. Your practice is supposed to be more cost-effective, efficient, and well-informed. You shouldn't be doing guesswork. And most of the time, the downside is there is a likelihood of a loss of confidence within the practitioner and the patient, because he just asked me to do what so many other people have said I should do in the past, and he didn't even change what they were doing. I didn't change anything for me.
That's huge. I mean, you're coming for a solution, and then you're leaving back with your problem.
Exactly. So
Okay. Well, we have actually looked at a lot around, MRI, and, if you need MRI, if you're having back pain. And we've heard a lot of things from our authority, which is our Dr. Nnamdi Eze. Okay, we have actually come to the end of this episode. And just as always, do well to follow us and anticipate our next episode, because we always have a lot of value to give to you, to help you have a wonderful physical health and wellness. Of course, your physical health and wellness is our concern. So do stick right with us, and we'll catch you on the next episode. Bye.
Bye.